Now let's see what is pre-diabetes and what is the significance of the word pre-diabetes. We saw that after a 10 to 14 hour fast, if we give the blood for checking for glucose, and if it is the report is 126 milligram percent or more, it is diabetes. If it is below 100 milligram percent, it is normal blood sugar, and if it is between 100 and 125, it is called pre-diabetes. Pre means before. So pre-diabetes is like a condition before diabetes. So you are still not there, but you are close to it, compared to somebody who is far away from it when the sugar is below or glucose is below 100 milligram percent. So say if your sugar was 120 milligram percent, the fasting sugar, then you can easily go to 126, 127, 130 whenever your body gets even a little stress. And we will talk about different stresses, but suffice it to say that pre-diabetes means just before diabetes. Now, what is the significance of knowing about pre-diabetes? Now, in my opinion, diabetes is not like a diagnosis like malaria, that either you have malaria or you don't have malaria. To give another example, diabetes is not like pregnancy, that either you are pregnant or you are not pregnant. In my opinion, diabetes is a continuous diagnosis, that it doesn't mean that if your sugar is 126, you will have all the problems of diabetes, and if it is 125, you will have nothing. So it's a continuous reading, just like blood pressure, just like cholesterol values. So a diabetic with a blood sugar of 200 fasting or 180 fasting or 160 fasting will fare much worse than a diabetic with blood sugar of say 126. The same way pre-diabetic, a pre-diabetic with a blood sugar of 101 or 100 is just like a person who has a normal blood sugar, compared to a pre-diabetic whose blood sugar reading is 123 or 124. He's just like a point away from being a diabetic. So what I'm trying to say is that it's a continuous curve that we have to see, and the importance of that comes is that if we know that as pre-diabetic one is more prone to get diabetes, and if that person starts taking care of all the issues that can affect a diabetic's quality of life and health, then whether this patient gets diabetes or not, he will be in a much better situation health-wise. Let me explain. Most people believe that diabetes is a very bad disease and a lot of patients die because of diabetes, or a lot of patients or whoever has diabetes will die because of diabetes. That is not correct. Most patients with diabetes do not die directly because of diabetes. What I mean by that is, if somebody has diabetes, there are very few chances that the person will die either because of low sugars or high sugars. But there are much more chances that the person will die because of a heart attack, which is one of the complications of diabetes. Now we know that not only diabetes, there are many other risk factors that predispose a person to a heart attack. We will discuss them in a separate presentation. But to name some of them are, if a person is a man or a male, there are more chances of getting a heart attack. If anybody is more than 55 years of age, there are more chances of getting a heart attack. If somebody has a family history of heart attack, that person has more chances of getting a heart attack. If somebody had a heart attack in the past, there are more chances of getting the heart attack again. These are the factors one cannot change, but there are factors one can change, and these factors include diabetes, high blood pressure, high levels of bad cholesterol, smoking, inactivity, stressed lifestyle. So there is so much that ultimately comes together to cause heart attack. So if you know that you have prediabetes, in my opinion, it's like a stop sign which says stop, there is danger ahead. And if you know you have prediabetes, and if you improve your lifestyle and manage your other associated conditions better, that you start living healthy, eating healthy, exercising regularly, keep a check on your weight, stop smoking if you smoke, control your blood pressure, control your cholesterol, then whether you develop diabetes or not, you will have a better risk profile for suffering from a heart attack, and that is the one which kills. Even the commonest cause for people dying, even if they don't have diabetes, is heart attack, and second is the cancer. So if you have prediabetes, it suddenly pushes you to focus on your health, and that part of your health which will ultimately be the problem, and that is the heart attack. Yes, if you have prediabetes, it's good idea to keep your sugar under control by eating healthy, by exercising, but at the same time, that diagnosis also gives you an opportunity to decrease the risk of suffering from a heart attack, which is the ultimate cause of death in most diabetics. So instead of feeling bad about diagnosis of prediabetes, or instead of feeling comfortable that good, I didn't have diabetes diagnosed, think it as a gift to you. A gift like a ball which is showing the future for you and what you can do about it. Like a crystal ball which is showing you the possible futures and then giving you the ability to manage that future. So if you have prediabetes, decrease your cardiac risk profile that you don't suffer a heart attack. Simultaneously, automatically, you will also decrease your chances of getting diabetes, because proper nutrition, exercise, healthy lifestyle will automatically keep your sugar under control.